Thanks, Bill. Hello, everyone. I'll begin with the current healthy food and beverage environment in British Columbia. Next slide, please, Bill. The Healthy Food and Beverage Sales Initiative has been evolving and active in BC since 2006, and BCRPA has been involved in this work all along. Activities for this current cycle are being led by BCRPA in partnership with CACO 2 and the BC Ministry of Health. BCRPA's role is to oversee the revitalization and expansion of healthy food and beverage within municipal community recreation facilities in BC. We're also supporting the CACO 2 partners in implementing healthy food and beverage in the jurisdictions. We're providing training for the jurisdiction coordinators. We facilitate monthly teleconferences where we can share progress and problem-solve issues. We compile evaluation data collected by jurisdictions, just as examples. Next slide. To get revitalization and expansion started in BC, funding was provided by the Ministry of Health. 13 seed grants were issued to 10 communities. 4 recipients were communities who had no experience with healthy food and beverage, and the remaining 6 recipients had experience between 2008 and 2010. One of these experienced communities received funds to address 3 different food environments within its facilities, so not just vending, as PJ had mentioned earlier, but concessions and catering as well. As a condition of the grant, recipients were asked to attend training on how to implement healthy food and bev and what tools and resources are available to support the work. Recipients are required to submit assessments of their facilities and audits of either their vending machines or their food services at the start and end of the grant cycle. They're also required to participate in telephone interviews midway through the process and 1 year later. Next slide, please, Bill. So here are the results from the initial vending audits that BC communities submitted back in March last year. To clarify, foods and beverages are rated against nutrition guidelines for vending set by the Ministry of Health. Items are rated into categories of choose most, choose sometimes, choose least, and not recommended, and these ratings are based on the sugar, fat, and sodium content of items. The voluntary goal is to have at least 50% of the items come from the choose most or the red category that you see there, and up to 50% of the items come from the choose sometimes or blue category. So how did we do? For foods, in the upper left circle, it shows only 6% of the items fit into the red or choose most category, and the majority of the foods were rated as either not recommended or choose least. That's the purple and green categories. For beverages, we did a little bit better. The upper right circle shows 27% of items fit into the choose most category, and the majority were rated as not recommended or choose least. So that's our baseline. Next slide, please. So what's happening in BC? We did mid-process telephone interviews with healthy food and beverage leaders, and they told us how their activities were going. Many of the leaders say that activities go well if there's strong support or buy-in at all levels, from patrons to facility staff to senior managers and local municipal government. So to highlight this, one community's municipal council made a philosophical decision to offer only healthy eating items in their community centers. Support from the councils made it easy to make changes across the board, and they've had great feedback from public saying, thank you for making healthy options available. But to get buy-in, it's really important to communicate the healthy food and beverage message to everyone involved. So, for example, leaders are presenting assessment and audit results to senior management and local government. They're sharing the goals or policies that have been put in place with staff, and they're hosting taste testing events for patrons to promote healthy eating awareness. Communities are also collaborating with the food industry. They are including healthy food and beverage activities in their contracts with food providers. We know of one vending contract where the onus is on the food company to only supply products that meet the nutritional guidelines for vending. And as well, industry is working with communities to promote healthy food and beverage. One community company hosted a menu tasting event that featured recipes that fit the nutritional guidelines for vending. Next slide, please, Bill. So here's an example. It's a photo of how one vending company has worked with the community to provide signage that promotes healthy eating. It includes the city's logo, which is on the left-hand side of the top the photo and the company's name, and it promotes a checkmark system that shows which items are healthier eating choices, so customers have guidance around selection. Next slide, please. Here's a close-up photo showing signage explaining the checkmark system that's stuck right on the vending machine, and it's provided by the vending company. Inside the machine, the items are marked with the corresponding check marks if there are choose most or choose sometimes items. Next slide. We appreciate that taking on healthy food and bev can be daunting at first, but we know that small steps have big impacts. One community used their seed grant funds to purchase a panini grill for their facility cafe so they could provide healthy sandwiches instead of the familiar burgers and hot dogs. The outcome is that patrons love the fresh, healthy options. Another facility chose to focus their activities on their youth program. The program has direct control over what healthy eating items are offered, and they've introduced something called Fresh Fruit Fridays, where fruit is available to the youth at no cost. The lounge is also stocked with items that have been taste tested by the youth, and the big success is that the healthy food and bev activities are guided by the youth participating in the program, and they're known as the Youth Focus Committee. Next slide. So here's a photo of a nutrition poster that the Youth Focus Committee helped to create to promote healthy eating. They chose what issues to address and made sure that the information came from credible sources. So you can see that the youth found a lot of important issues for them. Next slide. So what are the challenges that have been expressed? Many said that human resources are a challenge. Healthy food and beverage work is added to the regular duties of facility staff. There isn't financial support available to hire staff to carry out the work. As one facility leader put it, it seems to be off the sides of people's desks. And in smaller communities where staffing is more limited, even when the interest is strong, they simply lack the personnel to carry out the work. Revenue loss is also a concern that can make healthy food and beverage hard to implement too. Typically, the concerns are expressed by vending companies and managers who are interested in the financial bottom line. Vending machines need regular monitoring. Although the companies are supportive of healthy food and beverage, often the company driver who's stocking the vending machine doesn't always comply because he's working on commission. Machines are restocked with unhealthy items that the driver has on hand, like candy, pop, and chips, the moneymakers. The available choices within the facility impact the success of healthy food and beverage too. If unhealthy eating options are in close proximity to the healthy options, the uptake of the healthy items is low. One leader said that when they provided only choose most and choose sometimes items in their vending machines, uptake was really good. But when choose least and not recommended items were added, uptake of the choose most and choose sometimes items fell off dramatically. Similarly, if you have a facility where healthy items are available in only one area, but the remainder of the facility offers unhealthy items, the healthy eating message is undermined. There's competition within the facility. Next slide, please. So what helps with these challenges? In terms of human resources, communities say that building the capacity of those doing the work has been helpful. So that's the training that was provided and the tools and resources offered. At BC RPA, we've also been providing mentoring and networking for leaders through our bi-monthly teleconferencing. I've done a few site visits, and there's telephone support as needed, so the leaders have someone they can speak to whenever they need help. For revenue loss, our leaders say that our Overcoming Resistance document and the success story videos discussing revenue loss are useful for addressing concerns. And these resources come from our Stay Active, Eat Healthy website that PJ had mentioned earlier. Communities also have positive attitudes towards healthy eating. One said, we're not doing what we're doing to make money off of people eating junk food, and we're trying to promote the benefits of the lifestyle. Next slide. For available choices for healthy food and beverage, what helps is to have only healthy eating items available. We've seen this in the community I've mentioned earlier, where the local council made the decision to only offer healthy eating items in their community centers. And for cases where unhealthy food choices are being stocked in vending machines, maps or what we call planograms showing what items go where within the vending machine are very useful. And of course, making the effort to provide or to build positive relationships with the drivers always helps. Communities are also using their contract renewals with companies to leverage the inclusion of and compliance with healthy food and beverage activities. Next slide. What's next for BC? Grant recipients will submit follow-up audits in May this year. Their results will be compared with the baseline audits that I showed you earlier. Recipients will also participate in post-implementation interviews where they can update what went well, what didn't, and share what they're most proud of, amongst other things. The BC Nutrition Guidelines for vending are about to be updated. This will impact items sold in recreation facilities, so follow-up work will need to be done to adjust to the updates. And finally, BCRPA has received additional funding from the Ministry of Health to continue the work of healthy food and beverage. That's it from BC. Thanks for your attention. I'll pass on to Jan.